interestingly, what you said, people who get exacerbations and who phone me, now they wouldn't be living in the area, but they would phone me for secondary advice, let's say. I would advise them to go along to their own doctor, but I would try to tell them that it's possible to keep on the LDN. The symptoms, if you instead of 60 milligrams of steroids, which is high dose, take 15 for 4 or 5 days, or play it by ear. These people have all got better within a week or 10 days. So that's a very lower rate or severity of illness. And, you know, I'm not against steroids. I mean, I use them all the time as a general physician. But you just have to be wary about their effect on the immune system. And LDN is basically, as we know, and I was delighted to hear the extra physiology that's now being known about how LDN may work, because it's extremely complex. But people who are on steroids, and some people are on low-dose steroids, 7, 10 milligrams, that kind of thing, I prefer they wouldn't be on them, and I'm not inclined, and they tend not to do that well. A high percentage of the people who responded and who were getting benefit noted they had one symptom improvement, maybe. That's around 70+%, I would have thought. But by and large, the clear analysis of this, if I get a 100% response rate, which I hope to do in time, will be clearer and will give me better insight into this. But what is very obvious to me from these stats is that there is some benefit to MS patients who use LDN, and the figure is around 70% plus. The degree varies from almost total cure, a cure in inverted commas, to modest improvement in one or more or other areas, one or more symptom areas I'm talking about. However, all the successes are significant, and the patients want to continue. That's very obvious. Whereas when they go along to the hospital clinic, you know, almost automatically it's very negative. They get very negative kind of directions. After 40 years practicing medicine now, I'm a little wary about research, and I don't know how good or bad or indifferent it is, but the first question I'd always ask is, who's paying for it? Because the former editor of the British Medical Journal, who retired last year, has written a book in which he says most of it is bunkum, because you're actually getting what you're paying for, and it's who you're paying for, and if they're not getting the results, that's it. I don't know, but you have to worry about that. The research that we're conducting through Limerick University in Ireland is a mixture of stats and a mixture of the interviews. And this research, to my knowledge, is moving in that direction. And I think that's a good thing. As I say, all the successes to the patients are significant and point to the fact that this drug in small doses is seriously helpful to a large number of patients. It is almost free of side effects, non-toxic at this dose, and is cheap, and at the very least should be an offer to all the MS patients, particularly those who are newly diagnosed. If the 7,000 patients in Ireland with MS had been offered LDN at diagnosis, how different might their picture be now, and how much money might we have saved? You see, if it's all about money, well, think of what the patients are costing when they go into the facilities. Ireland is a good country to try out this kind of approach, and people like Phil and Mary Boyle have been trying to get the government to initiate some studies in Ireland, because a lot of the early cardiac research was done in Ireland and Boston. You compare the Irish in Ireland and the Irish in Boston. One was a homogeneous population, the other was a mixed. And some very valuable findings were got out of that. In a similar way, neurological research could be done if somebody took the trouble to do it. However, like most countries, Ireland is riddled with complex business, politics, jobs issues, and something like this is easily pushed aside by both government and the medical profession. I think that has happened. Mary has found that by approaching government people. We always get lip service. We always get nice talk. Nothing happens. Now, it might be interesting to know that Ireland is the highest producer of pharmaceutical chemicals in the world per head of population. There's a huge chemical industry. And therefore, the politicians are not going to push this. I mean, they'll tell you directly, privately, you must be joking, man. They're going to say, we're going to China, you know, you can talk about our low tax rate in Ireland, which is the lowest in Europe. Anyone who wants to come, we've got a very low tax rate. And the medical profession know better because they don't have the information. They don't have any information about LDN. So what to do? Well, solid research, such as some as we heard, is wonderful. I think that it's, Dr. Cook is right. It's beginning to come from other sections apart from the neurological. That LDN is a useful drug and is being used in double-blind trials. But I think more and more research, small and large, if we can get it, that all builds up. Choosing the battleground of public opinion is vital. To swing it in favour of LDN, and patient power is important. And I'm wondering, is it government journals? Is it bringing a pharmaceutical company on board? But as somebody said this morning, there's no money in it. There really isn't when you consider the cost of producing a new drug, $1 billion to get one onto the market and so on. So who's going to get interested in this? Or is it by lobbying influential people? I don't know. But I'm encouraged enough by the story of the 2 Australian doctors, whom most of you would probably remember, who discovered the cause of peptic ulceration when they found the bacteria H. pylori in the stomach years ago. And nobody believed them, particularly the gastroenterologists at the time didn't. And they really were despised for quite a long time by most of their medical colleagues. But they were right all the time. They stuck to their guns. And, 30, 40 years later, they've been acknowledged. And everybody does it now. And a week's antibiotics is the usual treatment. So by an increasing number of patients being positive about the drug, and by some fair-minded physicians around the world just using it more, if we can get the word out there gradually, I think that will help. Just to finish, I'll quote Machiavelli. I don't know if that's appropriate or not, but Machiavelli, and I'm paraphrasing because I got this from a friend of mine once when he realized what I was at. He said, you're trying to do the impossible. But he said, anyway, he said in 1540, the hardest thing in the world to do is bring about a change in a society. Everybody will be against you, especially those with a vested interest in the status quo, who have lived for a long time with tried and tested ways, or who have something to lose. And I'm afraid he might well have been talking about LDN today. But of my patients, the 50 patients I mentioned, I mean, you hear the things that you hear other doctors who are using LDN say. Like one patient here says, my spasticity is gone, my nerve pain is gone completely, movement is much better, I'm off Neurontin, I'm off Lyrica, that's seriously good medicine as far as I'm concerned. Now, I'm not claiming it, but as the agent of it, I'm quite happy to be associated with it, And if 70+% of patients are saying something very positive about the drug, they can't all be wrong, There's got to be something that's, my balance is much better. Urinary, just like I said, urinary tract, etc., was the second highest improvement. But fatigue, particularly, and general mental agility and well-being was certainly improved in over 70%. Great energy, very stable, no deterioration. My memory is better. Other patients say I don't tell anybody to stop beta-ferrin or interference, because I can't, and I won't do it. But I just say, if you feel better, you're going to have to make a decision about that yourself. But I generally say anything that has a negative effect on the immune system, and we've heard about the innate, the different things that are there, and it's great. I mean, I feel particularly uneducated in immunology because it's moving so fast, and that's great. But I mean, and I think LDN does work somewhere in that field that we heard about this morning. But patients who are on beta-ferrins, or Copaxone is the kindest drug to be on, I find. Steroids and the beta-ferrins generally are not LDN friendly. And so I would say, see how you get on. If you're doing well, you're going to have to make up a decision about that. And when I get the whole 50 done, 100%, I'll get back to you.